trying to figure out how to minimize. I don't know. I'll just put you in the corner like that. Okay. Oh, shoot. All right. So, hi, Catherine. How are you doing today?
Doing pretty good.
Good. Can you just tell me a little bit about, what brought you in today?
Yeah, I've been kind of just struggling with a lot of things, mainly getting things done that need to get done, and like, I don't know, having motivation and getting out of bed, that kind of things. I've just been really struggling with stuff like that, and just kind of like negative thoughts rolling around.
Okay. And so today's going to look a little bit different. I will be asking you a little bit more questions. This isn't going to be every week where I'm asking you a whole ton of information. So I just ask that you just bear with me as we get through these questions. It's just so I can get to know a little bit more about you. Okay.
Okay.
All right. And you told me a little bit about why you're here. Have you been in counseling before?
Yes.
Yes. And about how long?
I probably stopped maybe a year ago.
Okay.
Yeah.
All right. And how old are you?
I'm 25.
25. Okay. And what is your marital status?
I've never been married.
Never been married. Okay.
Mhm.
Do you have any kids?
Nope.
No. Okay. And you already answered that question. You were receiving services before.
Mhm.
And just so you know, I don't know if the front desk told you this, but just to let you know that if you do email us, it may or may not be confidential, just because we can't verify that email is confidential. If
Okay.
contact us outside of our um, services, or like if you can't get a hold of us via phone. And
Okay.
do you remember what your previous therapist's name was?
Her name was Missy Gardner.
And are you currently taking any medications as a result of seeing someone? Were you prescribed anything?
Yeah, it was. I am taking medication, I guess. Yeah.
Okay. And if you're comfortable sharing, could you tell me what that medication is?
Yeah, I take a couple. I take Wellbutrin,
Okay.
and then I also take Abilify.
All right.
And I guess I also take, I forgot, I take Clonidine also, which helps me sleep.
Awesome. And could you tell me what you think? Do you think your physical health right now is good or unsatisfactory?
Yep. Yeah, satisfactory. Everything's pretty good.
Okay. Do you have any persisting health problems or health concerns?
I have scoliosis, so sometimes I'll have back problems, but that doesn't happen very often anymore.
Do you have any other chronic pain?
No.
And how are your sleeping habits?
I'm very good. I really struggle to fall asleep at night or stay asleep, I guess, both. I wake up like anywhere from like 10 to 15 times in the middle of the night and I don't stay asleep. So, like chronic insomnia, basically, since I was a kid. So,
So would you say that your sleeping quality is poor
yeah.
and you sleep too little?
Yeah. Or, I mean, it's a mixture. It's either too little or I sleep all day. So,
Do
either
you
too
have
little or too
disturbing
much.
dreams or anything while you're experiencing that?
Um, Sometimes I do. Um, like I'll have dreams and I'll wake up like crying or like um, really anxious or really like on guard, I guess. I don't know how else to explain it. That only happens a couple times a month, maybe.
Okay. And how many times per week do you exercise?
I try to exercise like 2 times a week. Is probably what I actually get, but I try to exercise like 3 or 4, but usually doesn't happen.
And how long do you do that for?
About 30 minutes.
And are you having any difficulty with appetite or eating habits?
Yeah, I'd say that it's kind of like the sleeping. I eat too little or I eat too much.
Okay. And are you currently binging or restricting your eating intentionally?
No, not currently.
Have you experienced a lot of weight change in the last 2 months, either gaining a lot of weight or losing a lot of weight?
I've gained weight, but I don't know if I've gained a lot of weight. I've gained like maybe 10 pounds within the last 3 months.
Okay. Do you use alcohol regularly?
I use it socially, so maybe I have a couple drinks a month.
Okay. And have you ever engaged in recreational drug use?
No.
Okay. And some of these questions are pretty straightforward, other ones aren't. So, have
Yeah.
suicidal thoughts recently?
Not recently, no.
How about in the past?
Yes.
So, if you were to say frequently or sometimes, rarely or never, what would be accurate for that?
In the past?
Yep.
Frequently. I was hospitalized twice for suicidal thoughts.
Okay. And do you feel that you can keep yourself safe while we're here together today?
Yes.
Okay. And are you currently in a romantic relationship?
No.
Okay, we can skip those. In the last year, have you had any significant life changes or stressors?
What's happened the last year? I moved out of my parents' house, which was kind of a stressor. Well, living with them was also kind of a stressor. So, I guess that, and I guess just school and starting my practicum and internship has been pretty big life stressors. But besides that, nothing else major.
Okay. Have you experienced extreme depressed mood?
Yeah.
Wild mood swings?
No.
Rapid speech?
No.
Extreme anxiety?
Yes.
Panic attacks?
Yes.
Do you have any phobias?
No.
Sleep disturbances?
Yes.
Hallucinations?
No.
And have you had any unexplained losses of time?
No.
What about unexplained memory loss?
No.
No? Okay.
Mm-mm.
Interesting question. Sometimes people get tripped up on. I know I do.
Yeah.
And have you had any alcohol or substance abuse?
No.
Any frequent body complaints about pain?
No.
Any eating disorders?
I have struggled with restricting in the past.
Any body image problems?
Yeah.
Do you have any repetitive thoughts like obsessions, things that you think about a lot?
Yeah, I'd say sometimes I do, yeah.
Okay. Any repetitive behaviors?
No.
No. Like hand washing, frequent checking, none of that.
No.
You had any homicidal thoughts?
No.
You're currently employed?
No.
And I think you already answered you've had past suicidal attempts. Is that correct?
Not a suicidal attempt, but suicidal. I've been hospitalized for
Oh.
suicidal plans.
Okay. So, plan. Make note of that. Okay. And do you consider yourself to be religious?
Yes.
What is your faith?
I'd say that I'm a Christian.
Do you consider yourself to be spiritual?
Yes.
Has anyone in your family experienced difficulties with depression?
Yes.
Could you tell me who that might be? If you don't?
Yeah, it runs in my mom's side of the family. So my mom struggled with it a little bit, and then like her sisters have, and some other family members of hers.
Okay.
I guess they're mine too. But
Okay. And what about bipolar disorder?
no.
Okay. And any anxiety disorders?
I'd say that I don't know if I consider it a disorder, but I know my dad has some anxiety issues.
Okay. What about panic attacks?
No. Not that I know
Schizophrenia?
of. No, not that I know of.
Substance and alcohol abuse disorder?
I don't know if I have anyone in my family who's been like diagnosed with that, but I know that my uncle struggles with it a bit, and so does my brother. So
Eating disorders?
no.
Learning disabilities?
My brother has ADHD, and I also have ADHD.
Any traumatic history in your family?
Nope, not that I know of.
And has anybody in your family had, or anyone you know of, had suicidal attempts?
Yeah, my mom's uncle completed suicide when she was like in high school, I believe.
Okay. And what do you consider to be your strengths?
I guess no. Hey, I'm busy. Sorry. My strength, I'd say that I'm really compassionate towards people. That I really care about others, and I'd say that I'm a hard worker, and I'm really passionate.
Okay. And what do you like about yourself?
I don't know. It's a hard question. I guess I do like that I care about other people and that I help other people.
Okay. That's great. And what are effective coping strategies that you've learned?
I like to meditate daily, so I do that a lot. And then I try to work on my negative thinking and try to change it. I just change my thought processes a lot. And I also, like on a different level, I like to play with my puppy. and I like to play the ukulele, and I like to be outside. These are the best way.
Awesome. What are your goals for therapy?
My goal, I guess, would just be to help work on getting back into the swing of things, I guess. I feel like I've just been, I don't know, struggling for so long and just having, like, trouble finding motivation to do stuff. So I just kind of want to find a way to get motivated and to get back into the swing of things, I guess.
Awesome. Well, we are coming to the end of our time, but as we work together, we can definitely tackle more of these things together and be able to take some of those goals and kind of expand on them and figure out what works best for you in our time together. Does that sound okay?
Yeah, that sounds good.
Great. Well, I will see you next week and you can schedule another appointment up at the front desk, okay?
Okay, sounds good.